Hi guys, hope you're well and welcome to this edition of CBAT TV. I'm delighted today we have someone of exceptional qualities on the line to talk to us. We've got Simon Blake, who is the CEO of the Mental Health First Aid England. So thank you very much for coming on, Simon.
Absolute pleasure. Thanks very much for inviting me.
Yeah, not a problem. It's a very important subject we're talking about today in relation to mental health, and particularly mental health first aid, because I still believe that there is a lot of people who don't really know what it's about. They've heard of it. So I'm hoping that we're going to clear all this up on this talk today and get into some really important matters that go on. Now, Simon, how long have you been at Mental Health First Aid England?
I'd love to say 6 months because it feels like it, but I've actually been there almost 2 years now. I started October 6th, 2018. Yeah, brilliant social enterprise doing really important work around promoting positive mental health in the workplace, delivering mental health first aid training, but also trying to eradicate the stigma which is still there in relation to mental health and mental illness.
And is it very much, I mean, I'm just sort of like trying to draw a close relationship, if you like, between courses. And obviously with the word first aid in there, a lot of people will start thinking of physical first aid. So, whether it's emergency first aid at work, which people have been on courses. So what is the fundamental difference, without it being too obvious, between a first aid course where we're dealing with wounds and bleeds to a mental health first aider?
Sure. So, mental health first aid does do that first point of response when there is a difficulty or an issue, in the same way physical first aider would. But the really important bit about mental health and mental health first aid, of course, is that we need to have conversations. People need to have the knowledge and understanding. We need to try and prevent poor mental health and promote positive mental health. So mental health first aiders know and understand about common mental health conditions, have the skills to have those non-judgmental conversations, because we still know that stigma exists in the same way it doesn't if somebody has a trip, and that people address from physical first aid, but also how to try and provide support for somebody to access other forms of support, or to find the resources within themselves to around self-care, around community help, around medical interventions where they're needed. So I guess it has a more of a preventative angle, as well as dealing with incidents and being able to address those points.
Yeah, I think the word preventative is probably key there, because someone who is first aid trained in the physical sense is positioned for when an incident or an accident or an injury has occurred, they will go to that person. In terms of the mental health one, is it more an ambition of putting people into a workforce that would know what to do in that a situation of mental health, would be able to assist and help the workforce? Is that sort of like the ambition of mental health first aid?
So as a social enterprise, our vision is around improving the mental health of the nation. That there is we know that there is an inequality between mental health and physical health. As a specific mission, we want to train 1 in 10 of the adult population. 1 in 10, because we believe that will create the cultural tipping point. So Malcolm Gladwell's theory around cultural tipping points, where you need a groundswell. You need a certain amount of people to actually get something to catch on. Whether that's he talks about hush puppies in his book around the tipping point, but what we're talking about is cultural change around mental health. We need enough people who can know it's important and have an unshakable belief that something needs to change. They've then got the knowledge and skills to recognise symptoms, and then to provide help and access support where people need it. So that's why we are talking about 1 in 10. We're currently at 1 in 69, okay. That's really important that we keep on making that progress. But back to your specific question, by having enough people in workplaces, in communities that are able to have the conversation, we believe that shifts the dial and enables us to move towards being a more mentally literate society, to have more mentally literate workplaces, so we can prevent poor mental health where it's preventable, either through systemic shifts, so removing stressors in the workplace, encouraging people to work better around digital, or to ensure that they have time off, all those sorts of things. Job design, that job is doable and that it's manageable, which we know is sometimes, in health and social care, it doesn't feel manageable and doable from the start. So that impacts. And then that people are able to spot the early warning signs, so that if there are signs that somebody is starting to be unwell, or they or in a crisis situation, that they can actually respond and signpost them to further sources of help and support, whether that's the employee assistance program, whether that's a conversation with their manager, or whether it's needing clinical help. That's the role of first aid, to try and encourage and help support people to access that support.
Excellent stuff. So, I mean, just because it is such a big subject, and at this moment in time, it's very poignant as well. I mean, it always has been, but it seems to be getting a lot more media coverage now, which is a great thing. There seems to be a lot more people sort of like opening their eyes to the to getting that better balance within a workforce, to help you and support your workforce. I mean, in terms of, let's say, for instance, I'm an employer and I've got 200 staff, let's say. So is the idea then that I would send some of my staff onto a mental health first aid course? And if so, what sort of things would they be learning on that course? I know you've gone through signposts, early warning signs, but how long's the course sort of like, and what are they coming back to me as?
So, if we just take one step back from it and think, we know that either the money and time can be invested upfront to prevent and to support people, or the cost to the business will exist because of sickness, presenteeism, absenteeism, people working during their annual leave, staying on late. So as an employer, we have a choice around supporting the mental health and well-being of our workforce.
Yeah.
And there is both a financial cost to the business, but there's also the human cost to our employees. So, and I just say that because I think I just want to take one step back, because whether it's mental health first aid or whether it's another way of finding of supporting people in the workplace, the most important thing that I would want any employer to take away from this call is, doing nothing isn't an option. And doing nothing doesn't save us money. It actually costs us money. A report from Deloitte & Touche last year said 42 billion pounds is the cost to businesses each year, which is up from 36 billion only 3 years before. So the costs are rising rather than falling. And in the context of health and social care, we know that with the limited evidence that exists, that health and social care staff do experience stress at perhaps a higher rate and higher level than a number of others. And the last 6 months is going to have exacerbated that for all sorts of reasons, which you will know better than or as well as I. In terms of then the mental health first aid course, if it was in a face-to-face environment, so had you asked me this question before March the 23rd, I would have said that it was a 2-day course. We now have that course online. So it's a combination of self-directed learning, 4 blocks of, and then 4 live sessions, which are done on an online learning hub. So to recreating a classroom sort of experience. And what people do is they learn about the signs and symptoms of poor mental health. They learn about their own values and belief systems and societal and systemic belief systems. They then have a 5-step process, which is the first aid process, which is about recognizing the conversations, leaning into them, being able to have them and give support in a signposting to other sources of help that's available. And they practice that and recognizing how to think about having conversations, how to think about signposting. So it builds people's confidence in what is really that first step, which is how do I talk to somebody who I am worried about, who may not have, if someone's got the cut on their leg or whatever, often you see it, everyone sees it, you both look at it and work out how to do it. With poor mental health, that may not be the case. So the key thing that you might recognise in me, if you were my manager, is not is not exactly what it is, but that I'm suddenly really punctual when I was always late, or I'm suddenly late when I was always punctual, or I've missed deadlines, or I haven't been doing the notes thing. So how do you then, in that context, have the conversation in a way which enables a person to feel supported and to ensure that there's help if they need it from other sources of support?
Yeah, I mean, just going back a couple of steps there, like you did back to step one, I actually completely agree with you on the point of doing nothing is not an option. And particularly when we look at the audience who will be watching this and viewing this, who will be predominantly from health and social care. And I know we had a pre-conversation around this, which I'd love to press record. But I'll try and repeat it, or at least get to it as much as I can. In health and social care, if you mentioned about March, and we're all knowing that we're talking about the pandemic, that is COVID-19. But what I'm seeing a lot in health and social care is staff that work within there becoming very tired now, to almost a burnout rate, because they've been scrutinised through this whole moment in time. They've had to abide by so many policies and procedures to keep the people they care for safe and well. And ultimately putting themselves and their families in danger in doing so. And I just look at that, and I look at annual holiday leave. If we look at the numbers, and I don't have the facts to back this up. I can only go on social media polls I've done, but certainly staff have not been taking their annual leave at the same rate as what they had been doing previously or in previous years. So they're working longer hours. If COVID did come into their setting, very stressful situation, relatives ain't not able to visit. So I just look at the nurse, the care staff member, anybody else that works in that industry, and think there is going to be ramifications of that if we don't do something in relation to their mental health, be it in 6 months, 12 months time. And I think that's why I go back to the point of, if we sit there and close our eyes to it and put our hands over our ears so we can't listen, then you're walking into a period of time that's going to be very disruptive if you don't do anything. So I just wanted to know what your thoughts were. Do you agree with that comment? Is it something that you guys are looking into?
I mean, absolutely. We know, and my partner's a dentist, and we live above the dental practice, and I have seen the energy that goes into adapting, the energy that goes into creating new protocols, the determination to do the best by the clients and patients. And we know that that's true in health and social care, and that we're also taking on the vicarious anxiety of families, of individuals, and holding all of those things. And of course, in the moment, we can adapt and we can be resilient. But we also know that where there are not energy, and where there isn't energy and effort to ensure that there is support and ways to process the experience, that is how you end up with trauma, which isn't dealt with, impacting on people later on. And so, our front line, the support service for key workers is based on that premise, that people need somewhere to talk and to process what's happening. But equally, people get tired and get burnt out, and there is we don't know what the future holds. And I hope whatever happens next, that we learn to adapt, don't we? We learn to adjust, and so whatever happens next, the shock isn't going to be there in the same way that it was to begin with. But we do have to be able to pause, take stock, find ways to recognise, to celebrate, to learn, to reflect, and to make sure that people have got the support that they need. Otherwise, we do head for burnout. Otherwise, we do head for trauma that isn't dealt with. And we know all of those things, and we can do lots and put lots in place to change that, of which mental health first aid is obviously a part. Employee assistance programs are obviously a part. Our front line as a helpline is a part. And then organisations will also know how they manage if there are bereavements, how they help people to move through these scenarios. So we've got lots of intelligence, lots of experience. We just need to pause. We need to make sure that we're thinking about this and looking at everything through a lens of mental health and well-being. I don't know how many reports there have been in the NHS. I used to work in the children's sector, and I know that there are an awful lot of reports around stress and social care staff. We have to look after the people who look after people. If we don't,
100%.
we end up with a profession that's unattractive. We end up with people leaving the profession, which is a vocation, and which is absolutely at the heart of those people. And we end up with people unable to do their jobs that they love well enough for a long period of time. So we know all that. I left the National Children's Bureau in 2004 or 2006, and there's a report about social care staff. Then we've had Health Education England, we've had the Social Care Council, if that's the right words, can't remember the right body at some point in time, I think it was. So let's not get another report. Let's take action. Let's heed what we already know.
That's a hallelujah moment, without a shadow of a doubt. Couldn't agree with you more. I think you're right. There'll be more and more reports commissioned, and they'll be telling us exactly the same stuff that we knew 10 years ago. Yeah. The reality of the situation in health and social care, as I see it, is that for a long time now, retention of staff has been difficult. Staff coming in and going out of the industry. Actually getting staff to want to come and work within the industry has always been problematic. Now, there's a number of things that people could put to that. They could put low pay, awkward hours, reward, in recognition that you get for it. So understandably, the industry as a whole in health and social care has got to find a way around that. But one of the things that it can do is learn to support people better, because we don't. Like it or not, you may think that you're the best manager in the world or the best CEO in the world, but that is your workforce. That's the people that's delivering your service. And ultimately, when you're young, and I can only reflect back to myself here, going into an industry when I was 17 years old as a care assistant, no one taught me about death. No one taught me about, what it's going to be like to see someone, with dementia increasingly become worse in their own physical state, or someone that you knew quite well that has a stroke that night and comes in and is unable to use the left-hand side of the body, so it may be. You were taught to be professional, how clear boundary lines you're there to do a job, but ultimately you're a human being, and all of that has an effect both on your emotion and well-being, as you said. And the support mechanisms that were there were shockingly poor, which meant ultimately you got to a point where you thought, I can't take this anymore in my life, and you left. And I think a lot of young staff coming into health social care, they don't leave because they're no good at the job. They leave because they've had no support or help to actually understand what the role entails. And certainly more and more within this period of time, like you said, we're so reliant on the people that care for us. And more and more during this period of time, we put more and more pressures onto people. So I'm, from my perspective, I 100% get you. And if somebody publishes another report that tells me that, then I'm not even bothering to read it at that point, because I'm thinking all it is another policy or procedure that's come into place, and there's no physical action behind it, which is why, when I first started, I'm going to be honest with you, it was only about a year ago, maybe a year and a half, where mental health first aid started appearing in my vision more and more. And then what I've seen constantly at that point is barriers of employers actually taking it on. And I'm, you talked before about you're at 1 in 69. I mean, that's without anything, that's a heck of a result. 1 in 69 of the population. To get to 1 in 10, though, I suggest we're talking millions and millions of more people. Maybe not millions, maybe that's possibly around those numbers. So it's still a heck of a challenge to go.
Yeah, and absolutely. Now, I guess there's just 3 or 4 things as you were talking. I think the first thing to say is, of course, exactly as you said, mental health is on the radar in ways that it wasn't before, and I think we have to celebrate that. I think the other bit is, recognising that a huge number of employers have started making some progress around it. And what the coronavirus pandemic has done, I think, is given us a long jump on that. So, I've been really, really thrilled to see people talking more about the well-being of staff. Now, I think we do have to be mindful that may be not across all sectors and all industries, but the NHS Confederation and their rethinking the NHS program, talked about mental health and the importance of that as we move forward. In a collaboration of mental health organisations have said, any recovery plan has to have mental health at the heart of it, and MHF England was part of that. But I think there's just two other things which I think are important. Coronavirus isn't the only thing that's happened in the last 6 months. Real life has continued. People have continued to get divorced, to separate, to be bereaved. We've had the killing of George Floyd, amongst other killings, and the movement around racial justice, as a result of that, real amplification and spotlight shone on it. The continued vilification of trans communities in the media. We know that LGBT plus staff often don't feel able to be their whole self in the context of work environments, and that staff who are helping and supporting others are often experience prejudice and discrimination as a result of that. So we've also got to just think about the different communities, the people who are supporting, and remember that yes, coronavirus has dominated 2020, but there have been a number of other things, and racism in particular is a global pandemic which we really need to get to grips with. And in terms of health and social care staff, there are huge numbers of black people and people of colour who also need support and recognition. Brilliant that there is a focus on anti-racism, but the shiny spotlight is also exhausting and tiring, and people are for people who experience racism, and therefore we've got to think about the different impacts of the workforce as we're thinking about mental health and well-being too. Again,
absolutely right in what you're saying. It isn't just about one thing. It's about the whole collective. I mean, what the bit that I sort of like, if I'm being questioned or I'm asking questions, and I think I'm getting a lot of it from this conversation as well, is often when we think of mental health, us uneducated people out there, you're thinking about the serious cases of mental health, when actually every human being on the planet will at times need help and support with their mental health.
And it's a really good point, actually, Paul. And when we talk about mental health, we're often talking about mental illness. Now, 1 in 4 people will experience a clinically diagnosed condition in their lifetime, and 4 in 4 of us have mental health. 4 in 4 of us have a brain. We all experience challenges in life which impact on our ability. And so often, when people think about mental health, we don't take that same sort of approach and understanding of physical health. That some days, you don't know why, some days some people might have illness which impacts on their mobility, and sometimes that pain will go away the next day. Sometimes it will last for 3 weeks, and you might have to go to the doctor. And it's not always a cause and consequence thing. It just is. Our mind and our body is a onesie. It's all part of the same thing. I have to credit that to Ruby Wax, who said it on a podcast that we did. I mustn't claim it for myself. But it is important to recognise that whether that's grief, bereavement, stress, burnout, all sorts of things which impact. And then there are clinical conditions, and then sometimes we might just not be feeling brilliant and not understand how and why. So it's a really important for us to recognise the different ways that poor mental health manifests, and how we can prevent and provide support to people as early as we possibly can, as well as we can.
Yeah, and I think that, going back to my industry again, I think that's one of the biggest issues. That one is we don't really talk, and two is if we do want to talk, there's not really anybody to talk to, which will bring me back to this first aid mental health. So ultimately, you are sort of like trapped in a way. And no one really wants to listen to you, because the problems that you want to share are the same problems that they're normally experiencing themselves. So that's why you're told to just get on with it. And I think as well for managers out there that are listening in, the amount of managers that I've spoke to over the last 6 months, even going back past 6 months ago, but it's been really emphasized the last 6 months, in tears, scared, petrified of what could happen. All of that is playing on the mental health, because they're trying to take care of business, their loved ones, they've got the pressures of the world upon them. Everything that they're hearing is normally of a negative term. And even those people need someone to go and speak to, because ultimately, and I always say this, Simon, I'm sure you'll agree, it's just something I've always used. Basically, you can have the most perfect building. Let's say it's a hospital or a care home environment, and it can have the nicest curtains, it can have chandeliers from the ceilings, it can have everything. But ultimately, the only thing that people that are being cared for are really interested in, the ultimate thing is who is caring for them, and how are those people. So I always say to businesses, your asset is not the curtains and the carpets and the chandeliers and the nice gardens. It's the workforce, because they're delivering the service that you're offering. And if we don't support them, I've always said this, if you don't care for your staff, how can you expect them to care for the people that's in your service? But I want to sort of like touch on a point within health and social care in particular. Ultimately, what you find is a lot of care staff do, or people within the industry, is they don't open up and talk. And when they do, there's not really anybody there to talk to. Because normally the people that they're trying to talk to are facing the same issues within a workplace that they are. And ultimately, when they do open up and speak to a manager, the manager has got their own problems, which are escalated so much higher as well. You think about this period of time, I've been speaking to so many managers over the last few months who are in tears to me on the phone. And I've never seen that. These are strong people, strong characters who've broken down, suffering from anxiety, not sleeping at night because of the pressures that they feel under at this moment in time. And although they're not there to be judged, they feel judged, and they've no one to talk to. So I guess my question to you is how do we sort that out? How do we give people the opportunity to talk to? Now, I know you're going to come back and obviously it falls very much into this first aid mental health training, but your message to those people and where you see it.
Sure. I mean, I think the first thing to do is to recognise that all of us have a what we would describe as a stress container, right? And a bit like we don't all have baths that are the same size or showers that are the same size, a stress container is different size. And what happens is that it fills up and it fills up and it fills up. And if we don't have a tap which enables it to come out, then clearly there comes a point when it becomes too much. And that's true of all of us. And we can all face different situations or all face the same situation, and we will all respond differently. And I know, for example, in my situation, whenever things feel too much, it's not one thing, it's a culmination. The old phrase, the straw that broke the camel's back, isn't it? It's that sort of bit of, and so that everyday tap relievers, our self-care. What do we do to genuinely switch off? How do we make sure that we're looking after our body? How do we get the right sleep, food, all of those sorts of things, which are the things which all of us need for our well-being all of the time. So that's the bit. Remember that none of us can cope with everything, strong character or not. We all have our limits, and we have to think actively about how do you turn that tap to release the pressure. And as managers, in an ideal world, of course, we would know how to help the people that we manage, and our managers would know how to help us, and that would be all the way through the chain. The reality is, the Chartered Management Institute, there's less than half of people who have any training around mental health. Now, in the same way that you wouldn't want a maths teacher to teach maths without having training, in the same way that you don't want people to do sex education without the training and the skills, you also don't want people who are set up to do a job, which includes the health and safety requirements in legislation, which includes mental health. We're about looking after the health, safety and welfare of staff, and managers are entrusted to do that, and they need to be supported to do that. So right from the boardroom through to those people who are working absolutely on the front line, there needs to be a clear spine of how are we going to support people all the way through that, and to recognise that none of us were born as people who have the skills to talk about things and without any training, where there are stigmatised issues, whether that's death, dying, bereavement, bereavement, grief, poor mental health. All of those things are all things which we have to learn how to have good conversations about them.
So I think you've just answered a few more questions already that I was going to ask, which is great stuff. And going back to the managers trained, again, absolutely right. I was a manager. I wasn't trained in this. So therefore, I'm suitably unqualified to discuss it. And what you find is when you're suitably unqualified, you'll either give the wrong information or you'll just put a brick wall up and not want to address it. So I think what you're touching on there is probably the first sales pitch that I would be going back and saying to these CEOs, and that is it has to start at the top to filter its way down. So realistically speaking, if you had your way, I'm guessing you're saying, and if you were looking at my industry, I know we can look at the wider workforce in the UK, but just looking at my industry, then realistically speaking, every manager should be on one. They should be getting trained within this field.
Absolutely. So it's about that whole organisation approach, isn't it? It's about recognising that there are a number of different things that we can do, of which training is one element. We also need to think about job design, think about how do you make it easy for people to complete their records. How do we make it possible for people to be seeing a client, processing that if they need to, a patient or whatever language you would use, and then have a bit of time in order to get to the next one, rather than you're here at 12 till 1 and then you're there at 1 till 2, but actually there isn't time to get from one person to the other or whatever it is. So chief execs and managers, we have to design a system which doesn't have stress inbuilt into it as much as we can. We then have to think about where there are inevitable stresses, and I would say health and social care inevitably, because of the nature of the work, does have those. How do you provide support for people? And training is one part of that. And I would just also like to remind people that employee assistance programs are incredibly well kept secret. and they provide excellent counselling and support, and they're confidential and they're separate from organisational systems in order to enable people to talk. So there's that managerial, there's the leadership responsibility, the managerial implementation of that, and then there's our responsibilities of how do we have those conversations where because I used to run Brook, the Young People's Sexual Health Service charity, and the people on the front line would always be the ones who would know when you needed an extra 5 minutes, an extra 10 minutes, or when you could change things to improve the experience for people or the experience for staff. And people who are working directly in the front line need to recognise those different responsibilities and collaborate in order to build systems of support that support staff wellbeing. If we don't look after ourselves, we cannot look after other people. It's as simple as that.
Right, okay. I'm going to delve a bit deeper now, and I'm going to give you the problem as I see it, and then we've got to find a solution. We have talked around it a lot during this conversation, but I want to go back to me being a boss of 200 staff. Mm-hmm. Now, if let's say that was a care home environment, there is a potential that my staff are having to attend 14, 15 training courses per annum just to meet with regulatory, mandatory and statutory requirements. And that takes up a lot of time, money, and at the end of the day, what we're being inspected on by the inspection bodies when it comes to training is, are we compliant with those key areas? It doesn't therefore need, so just taking it back, so the reason why we do first aid training, and I'd love to turn around and say that all employees do first aid training for the welfare of their staff. Please don't shoot me down in the comments section for what I'm about to say. The main reason that you're doing it is because there's the first aid regulatory orders. So there's law and legislation around it that governs that you must do this. Is that the same? I know we mentioned that mental health falls within the health and safety, and I'd imagine the Health and Safety at Work Act, but is it the same that there is a mandatory requirement for you to do this, or is that something that needs to happen? It needs to become statutory.
Sure. So there isn't a mandatory requirement that specifically names mental health first aid. What there is health and safety executive guidance, which talks about your risk assessments needing to include mental health, of which mental health first aid may be a part. We absolutely believe that it would be beneficial for mental health first aid to be in legislation, and the reality of that, of course, is that lots of employers go way over and above what a mandatory regulation would look like, but at least it would give a benchmark which everybody needed to be above. Now, I just go back to the point about your 200 staff and the mandatory training and that taking 14 or 15 days. Now, as I say, it's a little bit, I used to work in HIV, and it was, do you invest in prevention or treatment? Well, we're going to be paying for the treatment anyway. How do you make sure that we do the work to prevent so that you can ultimately reduce costs associated? If you take a purely financial case, that I absolutely know, and all of that research has said about Deloitte, from Deloitte and Touche and many others, shows that the economic cost of not doing something is greater than the cost of doing something. But there's also the moral imperative here, and there's also the human imperative. And I say again, for the staff who are working now, they deserve that support for their employees on a moral and human basis. So do patients, because if we don't look after staff, how will they look after those that they look after? But also for the longevity of the profession. We know that too often people are leaving too early, when actually it's the conditions that provide that impetus rather than the love of the job. And you're a much greater expert around all of that, specifically for health and social care. But we know that the caring professions and the teaching professions, that has been true for a long time.
Absolutely, yeah. So, I mean, I just want to sort of like tie this up a little bit because I have kept you for so long, and again, thank you. In terms of where we're at, I mean, I'm with you now. And I've got to say, it's not that I was a non-believer. I was always a believer. I just didn't see how we were going to find a way to penetrate through businesses to actually take this seriously. Not necessarily seriously. Seriously is the wrong word, but to put it in the same platform as all their other types of wellness training. I know it's not all about training, but ultimately putting that person in place. And I therefore would be saying to businesses up and down the country, you've got to make a start. You've got to do something. And then you can monitor the progress and the data as it goes along, which is always there to see, but if you can see it for yourself, then wonderful. So my message out to the CEOs that may be watching this or the managers is, it's not that much of cost. It's taking a little bit of time, but the most important thing is it's giving you an understanding and it's giving you an eyesight into what necessarily is present or what's coming and how you can help. I completely get the message of, it's all right doing the treatment, but you'll be doing the treatment forever if you don't find the cure. So I think you've got the first steps to the cure here. So I know that's not necessarily a question, Simon, but what I'm trying to do is just back up what you're saying, that actually now I'm looking at it, and if I was the employer of those 200 staff, the message that I'm going to take from this quite clearly is do something and start now. Let's not wait any longer. And that take the action instead of waiting for the policy to come out that you're all going to have to adhere to at some point, because the situation's only going to become worse based on the figures that you stated before, and it's going to get worse and worse because we're not doing enough. So start now. And I'd suggest if you were leaving us with one final message, I'll let you take it away. What would your message be?
Well, I guess, our mental health is at the heart of our humanity, isn't it? And our desire to feel valued for the work that we do and to continue to feel able to give, we have to be replenished. That old adage, you can't pour from an empty cup. So, whether you're a manager, whether you're a leader, whether you're an individual, what is happening at organizational level, at managerial level, and at individual levels to fill the cup, and in the caring professions, that there can never be a greater and more important question to answer.
Absolutely brilliant, Simon. I'm going to end this with a little bit of. I think it'd be wrong of me, I know I didn't ask the question, but I think it would be wrong of me not to find out a little bit more about you. When I was doing my own research into yourself, wow, what an inspirational person you are. And then what I haven't mentioned to the viewers is it's Simon Blake OBE, and there's an OBE for a reason as well. So, I mean, your background, you've mentioned a couple of them today, but what drives you to work in these social enterprises, to work within the charity sectors, to try and change and influence the world? What's driving you to do it?
A commitment to social justice and to fairness and to equity and a belief, I think, that we can be better than we are, and things can be better than they are. I absolutely believe that we have to be much more focused around inequalities. We have to be much more focused on the different prejudices and different hates that infiltrate society. If I can leave the world, having made a iota of difference in creating a fairer and better place, that would be the dream, really. And I guess in all of the situations, it's always about hearts and minds, isn't it? And it's very easy to think about legislation and about policy, but actually, that learned very early on that it's the conversations between individuals that get remembered, and we all have the power to make the difference. And so I guess every single person who's watching this will be in it for similar reasons, I think, which is the desire to make a difference and to make things a little bit better or easier when they can never be better. Yeah, there are some situations. So my brother died a few years ago, and there was nothing that could be done about that. But the staff who looked after him and looked after us in that made a really horrible time just that bit easier. And I think that is absolutely what drives me, is recognizing we can be better. We have to take action on the inequalities, and by caring and being kinder in everything that we do, we can make a difference on individual lives. And sometimes when the world feels as it does at the moment, I think that's probably the thing to do, is remember that a 5-minute conversation might well be the thing that saves a life or changes a life or just eases a bit of pain in that moment.
And if you're listening to that, just rewind a couple of minutes and re-listen to it, because if you were ever after motivation, you've just heard it right there. You are an absolute inspiration. The more I looked up Simon, the more I was in awe, and I take my hat off to you. It's your career and the way in which you've played that out, and your beliefs and your values and how they shine through. Phenomenal. We could all do well to listen to someone like yourself more. That leads me to a point where right, our audience are listening. They've listened in. They'll have heard me witter on, as they often do. They'll have heard the sense coming out of your mouth. Where are they going to go find more information from? mhfaengland.org, or they can look at the Twitter handle or LinkedIn, Mental Health First Aid England, or Google it. Mental Health First Aid England. Presumably you can put some notes. Can you? I will be putting many of them on. Yeah, we'll sign.
I'll send you some links so that we can do that. But it's mhfaengland.org, and anybody who's on social media who is interested in any musings that I have is at Simon A. Blake on Twitter, or on LinkedIn, Simon Blake.
Brilliant. Excellent. Guys, I hope you've really enjoyed this one. I know I have. It's certainly given me more of an insight into what Mental Health First England are and what they do and what the future holds. I hope if you've got any questions, if you post them in the comments or you direct message us, if you've got a question direct for Simon to answer, I'm just going to put it out there and hope that he'll take the question for you and answer it back. But if you're a workforce, if you're working in a workforce now and you think that actually what you've heard makes a lot of sense, then go have that conversation with your manager or with your team. Investigate it further. Come and find out more information about it. If you're a workforce that's been thinking about this, it's time to start doing it. That's what I would say. And like I said, not everything is a monetary value. Emotional value, well-being, humanistic values, they're the ones that actually we should have learned through this period of time are the most important to us all. So I'm going to wrap it up there. I'm going to thank you very much, Simon, for coming on board and speaking with us. Go over, follow Simon, follow Mental Health First Aid England. It's phenomenal what they're doing, and I'm a believer. That's what I will say. So certainly I'll be looking more into this myself. But Simon, thank you very much for your time, and I'll leave it there for yourself.
Thank you.
Okay, brilliant, guys. If you have, if you watched this through, give it a like. If you've watched it on YouTube, hit subscribe so you don't miss anything. If you're watching it on one of the social media channels, LinkedIn, Facebook, Instagram, then give it a share. With things like this, the most important thing is that we share information. So share it out, let other people listen. If you've listened to 10 minutes, go grab a cup of coffee, and you want to listen to the next 10 minutes, you don't have to listen to it in one go, but it is very important stuff. And feel free to come and contact us at any time, and we'll certainly pass on information. Okay, thank you very much. Have a great week, and I will see you all soon on CBAT TV. Thank you.